Assalamualaikum and a very good day to Madam Asma and all my fellow friends. Early detection of alpha plus thalassemia trait in Malaysian adolescents is the title of my case study report that I'm going to present today. I am Erdawaty Dzulkiflie, and without further ado, let's get started. The objectives of this case study report presentation to provide detailed analysis of the case study by communicating the key findings and insights from the reports. Here we can illustrate a real-world application of theoretical concepts that we have been learned. Critical thinking was used to facilitate a discussion about the subject matter. On the other hand, we can offer recommendations or potential solutions based on the case study findings. Ms. Nurul, a 16-year-old Malay girl, previously enrolled as a Form 4 student in a secondary school in Batu Pahat. She participated in a thalassemia screening program as a candidate due to her age and demographic profile. Prior to the screening, the patient had not displayed any symptoms suggestive of thalassemia. There was no documented history of anemia or thalassemia in her family. Additionally, she had never undergone previous testing for anemia or thalassemia. With her parents' consent, she was eligible to participate in thalassemia screening program. The results show the patient's full blood count with hematological parameter of normal hemoglobin and lower mean corpuscular hemoglobin level. Then, further testing of HB analysis shows normal results with normal microscopic of hemoglobin and hypochromic microcytic red blood cells. This indicates the patient was categorized as D13, which is to rule out alpha thalassemia trait. This must be proceeded with DNA analysis for confirmation testing. This figure shows the microscopic of blood film during HB analysis testing. The red blood cells were hypochromic, pale color, while microcytic means smaller size of red blood cell compared to the normal one. This figure shows the HB analysis results coding table, where the thalassemia programs itself has made this code to categorize the diagnosis group with suggestion of next actions need to be taken. In this case, D13 was the impressions since the patient's mean corpuscular hemoglobin levels was 23.0 picogram, which is less than 25 picogram. According to the DNA analysis report, this patient has shown a specific mutation known as negative alpha 4.2 deletion. This involves the deletion of a genetic segment on one of the alpha globin genes, specifically the alpha globin 2 or HbA2 gene, which results in reduced production of alpha globin chains from the affected gene. However, individuals with negative alpha 4.2 deletion still have 3 functional alpha globin genes, 2 from one parent and 1 from the other. This usually does not cause significant health problems or symptoms. These individuals typically do not experience anemia or any noticeable effects on their health due to the presence of adequate alpha globin chains from the other 3 genes. For sample collection, it was venipuncture and at least 2.5 ml of whole blood was put into EDTA tube with proper labeling and tally forms. The blood then run for full blood count by using automated hematological analyzer, where in this case we use Sysmex XN1005. Normal hemoglobin and lower NCH level were the screening guideline. Then, a blood film smear with Leishman staining will be processed properly for outsourcing. Hospital Sultanah Aminah Johor Bahru using capillary electrophoresis method for HB analysis. After 1 month of turnaround time, HB analysis report was received. It happens that the patient needs for further testing of DNA analysis, where we outsource it to Hospital Kuala Lumpur with turnaround time of 1 year. Prior to diagnosis, genetic testing was recommended. In conclusion, the case of 16-year-old Malay girl diagnosed with alpha plus thalassemia trait highlights the importance of systematic thalassemia screening programs. This case demonstrates how combining clinical assessment with advanced laboratory tests can accurately diagnose and manage thalassemia traits. Looking ahead, it is crucial to continue efforts in screening, genetic counseling, and public education. These measures are essential in reducing the impact of thalassemia on affected populations. Early identification of thalassemia traits during teenagers allows healthcare providers to intervene promptly, providing necessary support and improving outcomes for both patients and their families. That's all from me, and thank you for your attention.